Hello, I'm Dr. Carlo Carandang with AnxietyBoss.com. Today, we will talk about burnout, anxiety, and depression, the pandemic, and implications for healthcare workers. So let's talk about the pandemic and its effect on society. So people keep saying that we're going to be experiencing a new normal, but there's nothing normal about this pandemic and how it's affecting us. Really, what's going on is an evolutionary change. It's nothing we've seen before. So, what's happening, you're experiencing profound social, occupational, economic, and political changes. And what's significant about this pandemic is that there is no end in sight. The future is unknown, and uncertainty is pervasive. In addition, there's this breakdown in communication as us wearing masks. It hides our nonverbal communication, so it further isolates us from one another. When we're not in lockdown, then we're hiding behind masks and we're missing out on our human need to communicate with each other. So the masks in itself actually hides us from each other, further isolating us from each other. So the pandemic has been quite detrimental for us social beings who need to communicate with one another. So let's talk about the pandemic and its effect on healthcare workers. So healthcare workers are exhausted. They're exhausted physically, mentally, and emotionally. And with regards to the crisis, it's just there seems to be no end in sight. The crisis is now chronic, and the thought of future waves is just more than what workers can bear. So, burnout from the pandemic and the consequences of it will become more apparent in the coming years. And I'm afraid you're going to see large numbers of people who actually leave healthcare because of the strain that it has taken on our healthcare system and its workers. Before I get into defining really what burnout is and the consequences of burnout, I want to also there's only so much that individuals can do, but with regards to the mental health and physical well-being of healthcare workers, it's really the duty of hospitals and public health authorities to ensure that their healthcare workers are not exposed to the virus. It's also their duty to maintain the mental health of their healthcare workers. And also, I would say that doctors need to advocate to hospital executives for the well-being of their staff. Because let's be honest with doctors. Let's be honest. You can't do your jobs without healthcare workers. You can't do your jobs without the nurses. You can't do your jobs without the clerks. You can't do your jobs with the people who are assisting you in surgery. You cannot do your jobs when no one's following your orders, right? So, doctors, you have to advocate for your healthcare workers. You can't just you have to do it. You have the power, and you have to advocate for your workers. In hospitals, you need to do a better job of protecting your workers and ensuring their mental health. It's your duty. So let's get with it. So the rest of the talk is really gonna be about um, talking about how the individual can help prevent burnout, but there's a duty of hospitals and public health authorities to ensure the mental health of their healthcare workers while at the same time protecting them from contracting the COVID virus. So, with regards to how to affect change at a hospital administration level, I would recommend that you unionize so that the union can advocate on your behalf. As I mentioned before, please align with your doctors so that you can affect change to support better working conditions for healthcare workers. Again, doctors can't treat patients without healthcare workers, so that's just the reality. Doctors, get out there, advocate, right? Also, the public has immense respect for healthcare workers. They really appreciate that you go out there every day and you risk your lives to help those who are suffering from this virus, this disease. So what you can do is try to get the public behind your cause because they are sympathetic to you. And if you get the public behind your cause, then soon the hospital executives and the public health authority will be forced to comply. So get the public behind you because they already have immense respect and gratitude to you. Okay, that's enough with regards to institutional and societal duties to healthcare workers. Let's now talk about how you can help yourselves to prevent burnout. So before we go into how to prevent it, you got to know what it is. So burnout is commonly referred to as being stressed out. So burnout is a result of exposure to mounting stressors, be it from your job, be it with relational problems, be it financial problems. So these stressors then, burnout is when these stressors overwhelm your capacity to cope with them. So you wouldn't get burnout if you had adequate coping skills to deal with the stressors. However, once the stressors overwhelm you and it overwhelms your ability to cope with them, then this could lead to burnout. So if you continue to have all this stress and you don't get proper help, then you can develop burnout, which is also known as being stressed out. So with burnout, this is equivalent to an adjustment disorder where you start to have symptoms of anxiety and or depression, but it is not full-blown anxiety disorder or major depressive disorder yet. Right? So here's a flow chart. I'm going to break out my laser pointer. So in this burnout flow chart, here are the stressors here. So again, the stressors could be job pressure, relational problems, illness in the family, child rearing, looking after elderly patients, financial burden. So the normal things that families go through, these are called stressors, right? So ideally, you'd have support, you'd have adequate coping skills, you'd have a stable mental health to actually deal with all these things. However, with mounting stressors, then as it overwhelms your coping skills, this then turns to stress here. And then pretty soon, once it lasts a long time or becomes more frequent, the stressors, then this can lead to burnout, also known as stressed out. Clinically, this is known as an adjustment disorder, right? So if it continues, the burnout then could lead to significant mental health, mental illness, such as anxiety disorders and depressive disorders. And the unfortunate outcome of both of these, if you're burnt out, if you have burnout, or if you have anxiety, depression, what this ultimately leads to is departure from your job due to disability, or in worst cases, due to a progression of these disease states, would in some cases lead to suicide. And that's you don't hear about suicide a lot amongst healthcare workers, but it happens. And this untreated, as you know, depression untreated could unfortunately lead to suicide. So there's pretty significant implications for burnout, and if you don't deal with it, you can have departure from your job, and then you can suffer ultimately from significant mental illness such as anxiety disorders and depression. So with regards to burnout and adjustment disorder, if you continue to have all the stress and you don't get the proper help, then you can develop burnout, as I showed you on the previous flowchart. And again, clinically, burnout is the equivalent of an adjustment disorder, where you start to have symptoms of anxiety and or depression, but it's not full-blown anxiety disorder or a depressive disorder yet. So it's really important to deal with the stressors you're facing every day when you're treating patients, being exposed to the virus when you go to the hospital every day, and the strain this is taking on your mental and emotional well-being. If that gets too overwhelming, burnout, which is also an adjustment disorder, can easily occur in your circumstances. So, what are the symptoms of burnout or adjustment disorder? Well, it's basically you just look at the symptoms of anxiety and depression, and you'll find the symptoms of burnout. So really, these are what you see when when I'm treating patients with anxiety and depression. This is what you see when people have anxiety disorders and depressive disorders. So burnout shares the same symptoms such as irritability, fatigue, insomnia, poor concentration, poor appetite, anxiety, depression, anhedonia, where nothing, you're not finding pleasure in things anymore, negativity, social isolation, uh, poor job performance, and then fantasies of quitting. So these are some of the symptoms of burnout. And if you want to detect the early signs of burnout, if you want to see if you might be on the road to burnout, this could look like being frequently absent from work, being constantly late for work, your work performance has decreased significantly, you have a pattern of mistakes or minor accidents, you have a lack of energy, lack of enthusiasm. You can have emotional outbursts in the workplace. Uh, you might have unwarranted complaints toward the workplace, coworkers, and administration. However, as I mentioned before, those complaints against administrations are most of the time well founded. They, again, do not let the hospitals and the public health authorities off the hook. They're responsible to ensure that you are protected from disease, contracting disease from your patients, and they're responsible for your emotional and mental well-being. So I'm talking about with this unwarranted complaints when it's beyond what's reality, right? And then another way to detect early burnout is you'll see repeated complaints from co-workers or from patients about the care that the healthcare worker has provided. So these are some early signs to detect burnout. Okay. So when you have burnout, then you are at risk for the development of an anxiety disorder or major depressive disorder. So anxiety and depression are really two sides of the same coin. So if you don't get help for burnout, then you may develop an anxiety disorder and or depression. So which one develops depends on how you think about your stressors. Okay, so here's this flow chart. Let me get my pointer out. So here's chronic stress. So if you continue to experience chronic stress, which turns into burnout, which is also called an adjustment disorder clinically, then this could either progress into an anxiety disorder or depressive disorder. So how it actually differentiates is really how you think about it. So when you have stressors and you're burnt out, if you're thinking I'm going to fail and something bad will happen, this type of thinking can lead to anxiety disorder. And if you're thinking all is hopeless or I'm useless, then this could lead to depression. So this, what develops anxiety versus depression really falls to how you're thinking about your stressors and dealing with it. And so these are some of the thought patterns that may occur, which leads to these different states. Turn off my pointer here. So with the development of anxiety disorder, then this actually develops from this negative cycle of anxiety. So you usually there's a trigger here. So here's a trigger, and this is the stressor. So this could be real or imagined danger, right? Let me break out my pointer. So this trigger or stressor then, it can lead to thoughts about the stressor. I feel bad, so it must be bad. I can't cope. Something terrible is going to happen. And then what happens then, this could lead to feelings of being anxious and fearful. And then you might have physical symptoms of anxiety, lump in throat, butterflies in the stomach, constant muscle strain, headaches, so those type of things. And then these feelings can then lead to behaviors where you avoid or escape to try to deal with your negative feelings and your negative thoughts. And you try to cope by doing things that help you feel better or to make you feel safe, right? And then this then leads back to more thoughts, more negative feelings, and it just feeds into one another with this vicious cycle of anxiety. And here is the negative cycle of depression. So it starts here with the trigger, which in this case can be job stress. Then this leads to thoughts of hopelessness, that you're useless, and I can't handle the stress. Then the negative thoughts induce depressive feelings, feeling blue, sad. And then these depressive feelings then can lead to avoidance. So the behaviors can include isolation, withdrawing, and putting off work deadlines, being late for work, or just withdrawing from work entirely. And then these behaviors then maintain the thought that all is hopeless. Then it continues this negative cycle of depression. It's a vicious cycle, actually, because it just keeps getting worse and worse every time it goes around. Turn off my pointer here. So how do resilient people handle stress? Because, not everyone reacts to stressors the same way. So those of you that are burnt out may wonder how those around you who are being exposed to the same stressors are actually handling it and appear to be doing well. So the answer is that these people are probably resilient in the face of such stressors, right? So there are multiple ways to have resilience in the face of stressors and adversity. So the first thing is a positive attitude. So thinking negatively makes you feel sad and bad. So having a positive attitude will put you in a better mood to deal with things better, no matter how distressful. People who are resilient also have hope for the future. So they are optimistic and have hope that things will improve despite a temporary setback that will help them climb out of the hole they're in, right? So another thing that resilient people have is that they see failure as constructive feedback. So resilient people see failure as a way to learn from the mistakes they made that contributed to the failure. So in times of crisis, resilient people take this as an opportunity to learn and develop. So it's an opportunity to change for the better. Resilient people also deal with challenges as they happen. So they don't delay in dealing with complex problems or challenges. Procrastination only leads to delays that can make the situation worse. Resilient people also lower their expectations. So if you have high expectations of yourself and others, then you will be disappointed most of the time, as you and other people can't be perfect or have a positive outcome all the time. So the key for resilient people, is to aim for average, and if the outcome is above average, then you will be that much more satisfied. And if the outcome is below average, then you don't have far to reach the average or good enough expected outcome, right? So lower your expectations is another thing that resilient people do. Also, resilient people are flexible. So people who are resilient are flexible in their thinking, and flexible in interactions with people. So they let things slide. They don't sweat the small stuff, right? So save your energy for more difficult challenges. Resilient people also focus on things that they can control. So resilient people don't worry about the things they can't control, right? So just focus on what you can do. If it's something external to you, like the hospital administration, there's things you can do to affect change at that level, as I mentioned before. Okay, but there's other things you can't control, so why focus on them? Another thing that resilient people do is that they regulate their emotions. So resilient people are steady with their emotions even when things around them become chaotic and are out of control. So regulating emotions is very important. So there's different ways to do this. I'll mention this later, but things such as meditation, yoga, progressive muscle relaxation, these kind of things to help quiet your mind. If you're having problems regulating your emotion, you might have to do some of these self-care techniques to actually quiet your mind. Okay. So burnout, anxiety, and depression. So how do you deal with it once you get to the point you get burnout or you get anxiety or you get depression, right? Again, burnout is an anxiety disorder. It's clinical. This is what mental health professionals treat. We treat all these things, right? So the first line of therapy is psychotherapy. Go to a therapist. Each one of you healthcare workers has an employer with an employee assistance program, right? So these programs are set up for you to help you when you have clinical problems such as adjustment disorder, anxiety, and depression. So go see a therapist, take advantage of your EAP program, and get the help you need. So get on with a therapist if you're experiencing these things. So cognitive behavioral therapy and short-term psychodynamic therapy are both effective for dealing with anxiety and depressive disorders. Also, if it comes to the point where your anxiety disorder or depressive disorder, such as major depressive disorder, are becoming more prominent and it's not responding to psychotherapy, then at that point you may need to see a psychiatrist, and the psychiatrist then has different medications such as SSRIs and SNRIs to help deal with your anxiety and or depressive disorders. Now I'm going to go into questions and answers. Was hoping to do this in person for live conferences, but unfortunately with the pandemic, here we are. We are doing things virtually, so I was asked to do this talk for a nursing organization, association, to help healthcare workers with dealing with burnout and stress. Unfortunately, this has to be done virtually. So I was asked to pre-record this, and here are some questions that the organizer had from their constituents. So the first question, what are some practical everyday techniques healthcare professionals can implement to avoid burnout? So self-care is very important. You have to quit isolating. I know you're out there slogging away in the hospitals treating patients, but you do have to focus equally on your self-care, right? On what you eat, on exercise, and doing things that make you feel good. So get a massage, go get your hair done if it's safe to do so from a public health perspective. So go out there and do the things for self-care. And if you're isolating and if you're on lockdown, then there's things you can do at home to actually affect for self-care, such as working out at home, exercising at home, and socializing with people like what we're trying to do right now through video conference, right? You can also try relaxation techniques such as yoga, meditation, diaphragmatic breathing, progressive muscle relaxation. So all of these techniques I'll point you to a website at the end where all these techniques are listed in a video and a guide, a step-by-step guide through videos to help you with some of these relaxation techniques. So at the end, I'll give you that website. You can also reach out to family and friends. Please take mental health days or go on vacation to recover, right? So if you are getting stressed out on any particular day for any particular reason, take a mental health day, right? Or take a vacation to recover. And lastly, the advice is that earlier slide on what resilient people do, just copy what they do, and pretty soon you could be a resilient person also that deals with stressors adequately. So you could function at your job better, and you can have stable mental health and emotional well-being personally for your family and friends. Another question. Many healthcare professionals have expressed feelings of grief from the losses of the pandemic. So how can we overcome this? Well, you see, you professionals, healthcare professionals, are treating patients who are dying and who have died and or are on critical support and need your services day in and day out. So I would recommend that within your hospital settings that you form support groups for the workers to debrief with colleagues on these feelings you have that you don't have time to debrief, because if you keep it all inside, you're going to be burned out and you're going to have anxiety and depression, right? So anxiety and depression are anxiety disorders and depressive disorders are classified as internalizing disorders. Internalizing meaning it's stuff that comes from your thoughts, it's stuff that comes from inside you, right? So the stressors are external, but they call internalizing disorders because it's stuff that occurs inside you. So your thoughts, your emotions, how you actually decide to make choices about behaviors which are helpful or not. So one way to deal with internalizing disorders that come from the inside is to start to expressing how you're feeling to others that actually are experiencing the same thing. And pretty soon what happens is that catharsis that occurs from actually just letting it out is actually cathartic, right? So that's why we do it. It seems trivial to just say, go talk about it, but that's really the work, is to talk about it with others going through the same things. And really, each of you, your colleagues, are the ones that can support you the best, right? You go home to your family, they don't really understand what's going on, right? They might have an idea what might be occurring, but they're not the ones treating patients. They're not the ones having to deal with hospital administrations not protecting you. They're not the ones having to risk their lives every day being exposed to this potentially lethal COVID virus. They're not the ones seeing other family members suffer loss when the virus kills their loved ones, right? So it's your colleagues are the best source of support at work because they're experiencing the same thing. So get out there and form support groups with your colleagues, right? And hold these frequently. So also debriefing with colleagues after each event that shakes up your unit, your medical unit. So like if you have a loss, a death on your unit due to COVID, then debrief with your colleagues. Debrief about that case with your colleagues, okay? And not just from an M&M point of view, but from a point of view that this is hard for you. This is hard for the staff to handle. So let's check in with one another and make sure everyone's okay. And if there's someone that's not okay, then we all support that person, right? Another thing you can do is go see a counselor. Again, see a therapist. That's what they're there for. And if you're on lockdown, a lot of therapy now is being conducted online. Okay. And lastly, you could just take off time from work to recover, right? So maybe you need to go take a few sick days. Maybe you need to go on short-term disability, but take time off to recover, because if it's affecting you, then you should talk to your manager, hospital administration, and they should not blink an eye when you ask for it. Okay. Another question: how to deal with family members who do not understand the stresses and burdens nurses face. Okay, so as I explained before in the previous question, uh, nobody else is going to understand what you're dealing with unless they're in your shoes. So your colleagues are really in the best position to understand what you're going through, and therefore that's the road to you getting help, is just being with people who understand. So you do have to go home to your family, who really don't understand what you're dealing with. And what's happening is they're probably seeing some of the effects of the trauma, this vicarious trauma that you're experiencing, through being exposed to the virus, risking your lives, being exposed to people who are dying from this. So it may help actually for them to tell them what vicarious trauma is. That although others are experiencing the trauma and loss, because you are a direct provider, care provider for those who are experiencing loss and trauma, that then this becomes vicarious trauma to you, because it's as if you're experiencing it because you're so intimately involved with the care of that patient and family. So explain what that is to them. Explain that your patient's loss a lot of times is your loss, right? So explain that to them. So it's not like any other job where you can just leave it at work. Healthcare workers can't leave it at work because what they do is so emotionally draining, especially this pandemic, and especially when they're dealing with all these losses. So it would also help to label your state. So if you're burnt out, just say so and explain your need and compassion on their part to recover. So just if you can just state that I'm stressed out and I'm burnt out from work and I need space to recover, that in itself can let your family members know that they need to back off and provide support when you ask for it. Okay? And also, lastly, an important thing is to set boundaries at work to help avoid bringing those stressors home. Because, at the end of the day, it's unfair to expect workers to do their jobs and then having to take it home. So as healthcare workers, you can't just do your job and then go home and then leave it at work. It doesn't happen that way. We're humans, right? We absorb all of these stressors, and we have to have a way to wring them out. We can't keep them inside. If we keep these stressors inside and we don't deal with it adequately, it leads to anxiety and depression, and then pretty soon it leads to you dropping out of work. Pretty soon, you need help from a psychiatrist. So you want to avoid having to see the shrink, right? So what you can do then is to set boundaries at work to help avoid bringing those stresses home. So for instance, if you're a therapist at the hospital and they keep bombarding you with patients to see, right? Although it's most healthcare workers will just say yes. They won't say no, is what I'm saying. So I know of healthcare workers that when they're asked to see more patients, they just go ahead and see it and double book their appointment books just so they could accommodate and be helpful, because we are in the helpful professions, right? So we have a hard time saying no. So just say no. And if it's a resource issue and if there's a big waiting list, you know what? At the end of the day, for the individual healthcare worker, that's not your problem. Your problem is your family. Well, it's not your problem, but your responsibility is your family. And it's really up to you to ensure that you don't go home, right? And take it out on them because that's what it feels like to them. So I'm just trying from the other side. I'm trying to be supportive of you, but on the other side of the coin, it's really up to the individual healthcare workers to set boundaries in work and say no. Okay? Can you practice that with me, healthcare workers? Just say no. Because if it's because there's too many patients, that is really not your problem. That's the hospital's problem. They need to hire more people, right? Right? They need to get out from their offices and maybe help you guys out at the front line, right? So um, that the wait list and the amount of work that you need to do is not really your problem. It's the hospital administration's problem. And it's your job to ensure that you can do your job to the best of your abilities. And you can't do the job to the best of your abilities if you keep saying yes, right? So say no. So that when you're seeing a patient, you can give 100% to that patient. Because if you're getting overbooked and you're having to see more and do more and work overtime, guess what? Each patient you see from after that point on, when you're burnt out, you're not giving them 100% of you. So you might as well just let someone else do it, right? So don't get to the point where you get burnt out. Set boundaries at work. Say no. Okay. Another question: how to overcome fatigue, anxiety, and burnout to excel at work, but also personally. So again, you can engage in self-care, as I mentioned in previous slide. Try to come to terms with uncertainty. So people are worried about the future, but the future is uncertain. Even the researchers, clinical researchers, and public health officials, they don't know what the future is going to be. They can make some predictive modeling to see how this pandemic is going to go, but at the end of the day, um, people don't really know what's going to happen. So you really have to come to terms with uncertainty, and you can't worry about it too much. So it's one of those things you can't hang your hat on. So just come to terms with uncertainty and follow what your public health authorities say with regards to um, the future, right? So those kind of things can actually help make things more certain. Now, if everybody followed what the public health officials were saying, maybe we wouldn't have all these waves that are coming, right? So, but in the meantime, we have to come to terms with uncertainty. Take mental health days as needed. You may need to go on short-term disability. You may need to see a counselor, and if you have anxiety and or a depressive disorder, you may need to see a psychiatrist. Now, I'm going to say this last one because this one's we got to come to grips with what's going to happen. Look, folks, um, you healthcare workers are tired. You're exhausted, and there's future waves coming. And there's some of you that are overwhelmed and seeing your emergency rooms and your medical units brimming, overfilling with COVID patients, and more coming. So the thought of future waves are just unbearable right now. You're exhausted physically, emotionally, mentally. So if it's really coming to the point where you're getting burnt out and you're really not wanting to go back to work because of the enormous strain that's put on you as a healthcare worker, then you may need to consider switching to another career, right? So I'm going to say this because the worst thing that can happen to you is to not have choices. So if you feel like the only thing you can do is be a healthcare worker and I can do nothing else, then it gives you the feeling of being trapped. So I just want to give you permission if you're getting burnout and it's occurring for too long, and especially if this is resulting in an anxiety disorder or a depressive disorder, then maybe it's time to consider switching. Okay? And you may need to leave the healthcare field altogether. So even just considering that allows you to have a choice. And when you have choices, then you don't feel trapped. So I'm just saying consider it if you're at the point where you're burnt out or you have anxiety or depression. Okay? So the take-home message, stress and burnout, if it becomes severe and chronic, may transform into anxiety and or depression. Therefore, it is important to deal with stress and burnout and to cope with it effectively. So the pandemic has caused profound changes with regards to social, occupational, economic, and political arenas. Very important. Your hospital has a duty to protect you from exposure to deadly pathogens and has a duty to ensure your mental health. Okay. Please align with your unions and please align with doctors to advocate for better working conditions. Okay. And for those relaxation techniques and self-care techniques that I mentioned earlier, you can find out more at anxietyboss.com. Thank you for listening. I'm Dr. Carlo Carandang. Thank you very much.